Hello, I'm Florence Tushemerirwe, a public health nutritionist and a lecturer, assistant lecturer at Makerere University School of Public Health. And I'm here to talk about the program that we set out to implement in Eastern Uganda. In March 2013, we set out to implement an integrated model for eliminating maternal and childhood malnutrition in Eastern Uganda. We are targeting mothers that are expectant and lactating, as well as children below 2 years. These are the children that we say are in the critical window of opportunity. It's the period between conception and 24 months for the baby. The goal for this program is to develop and test the feasibility of having a food product that we could add to the daily diet of the mothers when they're expectant and lactating, and the children when they start weaning at 6 months up to 23 months. And the aim is to prevent malnutrition during that period, as well as correct any malnutrition in that period for the mother and also for the baby. The specific objectives, we set out to conduct a baseline survey as well as a formative research, find out the baseline values for nutrition knowledge, attitudes and practices, and also to find out the baseline values for malnutrition in the community. We are working in Luka district, and we are only piloting this in one sub-county. And then the other objective is to document the process of implementation, because we hope to upscale this process to other areas of the country. The third objective is to correct any malnutrition that is within the community, as well as prevent that which has not taken place.
The good news for the mothers and children affected by malnutrition is that Uganda grows nutrient-rich, culturally accepted indigenous food crops that are sometimes wasted in times of plenty, while others are sold and not eaten due to myths. The low-cost food supplements is made in partnership with food technologists at Makerere University School of Food Technology, Nutrition and Bioengineering, and in particular with Dr. Gaston Tumuhimbise.
We started by soliciting views from the communities and knowing the foods that are available in that community. And we brought these views to our laboratory together with the samples of the foods used in the communities. And so far we have been able to develop 6 formulations, so to say prototypes, which we have evaluated with expert panels in our laboratories, in our sensory lab. And recently, one of the milestones is that we have been able to test these formulations with the communities themselves. We note something very important, that the way they were ranked by experts is the same way they were ranked by the communities.
Several achievements have been registered since the project kicked off 8 months ago.
We have already established a network at community level between local government staff, between community health workers, as well as the village health team members that we are going to be working with to implement the nutrition education arm, the behavior change communication arm. We have 36 village health team members mobilized, and we have already identified the virtual classes that we shall be using for trainings. We have a ready proposal that we are going to submit for IRB approval, and currently we are working so hard, we are working round the clock, putting the manuals together, and also waiting to incorporate the information from the baseline survey to update the manuals so we can hit the ground going with the nutrition education as well as the ready product. Because we promised to go down to the field with a package of interventions, a ready food product to use, and the cooking demonstrations, drama, as well as nutrition seminars. And then we are also going to use meetings, village meetings.
According to Florence, the project will also integrate hygiene and sanitation, family planning, and promote prompt care seeking for mothers and children in case of common illnesses.
I really want to thank you so much for taking time to watch this video, and I'm really ready for a Skype call, if possible, to answer my fire questions. And together with Dr. Gaston Tumihimbise and Dr. Peter Waiswa, we really thank you so much, Grand Challenges Canada and the Canadian government, for choosing to help us in rural eastern Uganda to avert malnutrition and improve community development. Thank you very much.